The images for this presentation were those of a 27-year-old multipara who was seen at 9 weeks of gestation. As you can see, the crown ram length was 2.25 centimeters, which gave a gestational age of 9 weeks. By 9 weeks of gestation, the midguts elongates rapidly and herniates into the umbilical cut base and returns completely into the abdomen by 11 weeks of gestation. Therefore, the diagnosis of omphalocele should not be bet before the 11th week of gestation. Here we can see the main ultrasound differences between gastroschisis and omphalocele. In gastroschisis, the bowel lobes do not have covering membrane, and the umbilical cut is inserted to the left of the defect. While in omphalocele, the bowel lobes have a covering membrane, and the umbilical cut is inserted at the apex of the defect. There are certain conditions that should be met before a pathologic diagnosis is met around the 11th week of gestation. One is when the liver herniates into a defect. Two is the defect is greater than 7 millimeters. And three, if the amount of herniation is greater or equal to the diameter of the abdomen. Under such circumstances, the diagnosis of an omphalocele can be made. This is the rendered image. You can see the reference dot here, the umbilical cord here, the amniotic membrane can also be seen here, and this is the chorionic cavity. On grayscale, the herniation is seen as a small echogenic blob which extends into the umbilical cord, as is seen here. And on 3D, the hernia sac is seen at the site of the cos insertion, as is seen here. Again, we can see the reference dot here, the physiological hernia here. Note the posture of this fetus and compare with this border posture. This images using Magicot, and these are without Magicot, all depicting the physiological hernia. Thank you.